Good morning. We will jump right in due to the timing where we are, but I would just like to say that we are all glad to have everybody here with us today after the long holiday. My name is Rebecca Martin. I'm with the World Health Organization Regional Office for Europe, working with the Vaccine Preventable Diseases and Immunization Program. I would just like to quickly run through the launch today and the roundtable event. To begin with, we will have the launch with welcoming remarks and then statements from 10 to 10:40. We will then have a 5-minute pause, allowing some people to have coffee and tea and others to depart for who will not be participating in the roundtable. And also then we will then move into the roundtable, which will be moderated by Professor Pierre Van Damme, and the countries present are France, Belgium, Germany, and Switzerland. We would move into closing remarks and be finished by noon. Lastly, I would just like to remind you, please, if you could put your phones on silent or turn them off with the microphone so we don't have loud noises occurring. So to begin the launch, I would very much like to welcome Madame Laurette Honker-Links for welcoming remarks, the Vice Prime Minister and Minister for Social Affairs and Public Health of Belgium. Please, you're welcome.
Thank you very much, Madam the Director, ladies and gentlemen. It's a real pleasure for me to welcoming you today in Belgium for this debate organized by the Regional Bureau of the World Health Organization in the framework of the Immunization Week 2011. Recent measles outbreaks in Europe ask us to remain vigilant. It shows that fighting infectious diseases must last even when the threat has faded away, like in the case of polio in Europe. It also illustrates that immunization remains the best weapon to stop the progress of an infectious disease, to reduce it, and finally to eradicate it. In the last few months, vaccinations have been at the center of an animated debate, among others on the H1N1 virus. The efficacy of vaccination, their secondary effects, the commercial interest are some of the items that have been raised. The mere principle of immunization has even been put into question by an increased number of people, be it through media, be it through petitions, or even through the judicial system. We have just experienced this in Belgium, where the compulsory character of immunization against polio is being jeopardized by a tribunal. It is concerning. If polio has disappeared from Europe, it is precisely thanks to the determination of former sanitary authorities which imposed immunization. And today, given the mobility of the population, we must remain more vigilant than ever. Questions and inquiries from the public opinion are obviously understandable and useful. Nevertheless, in this field of immunization more than in others, reason must prevail, not emotion. It is a guarantee for useful, constructive, and convincing debate. We must therefore keep our trust in science. Smallpox has been eradicated from the world in 10 years, at the end of the last century. Vaccination saved millions of persons. Immunization allows us to eliminate fatal diseases. It is maybe one of the greatest achievements of modern medicine. Thanks to hard work of so many teams of research, this achievement gives now hope to eradicate AIDS, of even cancer. Public opinions and authorities must support those working in research programs. We must also evaluate with professionals if our methods are pertinent and whether information is adapted in order to manage efficiently immunization campaign on the ground. In Belgium, communities are competent except for compulsory immunization and pandemics, which remain under federal competencies for obvious reasons of efficiency. Representatives of those communities will explain their policies in the debate afterwards. Efficiency of immunization means good coordination. Many epidemiologists insist on this point. We must improve international cooperation. We have done this during our recent presidency of the Europe. We have drawn the lessons learned from the H1N1 pandemic. One of the more concrete conclusions was to establish a common mechanism at European level to buy vaccines. The European Commission is currently working on this. Finally, strong and dedicated mobilization is required. This event with the presence of Princess Mathilde will certainly contribute. And I am convinced that the conclusions of this meeting will greatly help immunization campaign. These campaigns remain central for public health policies. I wish you fruitful debate. Thank you.
Thank you very much for those welcoming remarks. At this time, it's my great honor, and I'm very excited to be able to introduce WHO's Special Representative for Immunization, Her Royal Highness, Princess Mathilde of Belgium. Welcome.
Madame la Ministre, Regional Director, ladies and gentlemen, first of all, a warm welcome to Belgium. I am particularly pleased that this year's launch of the European Immunization Week is taking place in my country. And so it gives me great pleasure to join you today to launch officially European Immunization Week 2011. I am grateful for this opportunity to highlight an issue that I consider to be of great importance. This is why I accepted to become a special representative of WHO Europe in its fight against vaccine-preventable diseases in Europe. No child or adult should ever again die of these diseases. Mrs. Jacob, I thank you and WHO Europe for your trust in me, and I can assure you of my support. Today's message is simple: to eradicate vaccine-preventable diseases in Europe. However, in order to achieve this, a firm commitment from all states and full cooperation among them are required. Ladies and gentlemen, our greatest priority is to protect our children as much as possible. Parents need to be aware that it is good parental practice to have their children properly vaccinated against such vaccine-preventable diseases like measles, rubella, polio, as well as mumps and whooping cough. As a mother of 4 small children, I am fully committed to this on a personal level. But my commitment to raise awareness about immunization extends far beyond the bounds of my own family. Immunization is one of the most cost-effective health investments that a society can make. It is one that protects not just the individual, but also entire communities, countries, and regions from diseases that can result in sickness, disability, and even death. But we should not forget that immunization is at its most effective in preventing diseases when everyone works together. During the past year, we have witnessed something quite disturbing in the European countries region. Falling immunization coverage rates have led to outbreaks of diseases that were previously rare or eradicated in Europe. In 2010, we saw an outbreak of polio, the first outbreak we have witnessed in the region since 2002. Hundreds of children in the Central Asian republics and Russia were infected with the polio virus, and some lost their lives, tragically, to a disease that could have been prevented. In Western Europe, closer to home, we have seen numerous outbreaks of measles. Indeed, thousands of measles cases have been reported since the beginning of this year. In an age where vaccines can give protection against such diseases, it is alarming to see outbreaks continue to occur. The cost is high, both in health terms and because of the financial burden placed on a country's health system. At last September's meeting of the WHO Regional Committee, the countries of the European region adopted a WHO resolution to renew their commitment and accelerate action to eliminate measles and rubella by 2015. This target date can only be achieved if countries work together. No country can expect to be successful without the support and commitment of its neighbors and the region as a whole. With this in mind, the European Immunization Week 2011 team encourages us to find shared solutions to common threats. Je suis convaincue que grâce à notre collaboration, des solutions peuvent être trouvées pour faire face à ces menaces et que nous les trouverons. Je félicite les participants au lancement de la Semaine européenne de l'immunisation pour avoir donné la priorité à notre rencontre et manifesté ainsi leur solidarité. Je me réjouis de vous entendre échanger vos expériences portant sur la façon de réagir à l'irruption de maladies, et je serai heureuse d'apprendre comment vous envisagez la poursuite du processus visant à leur éradication. Finalement, à un niveau plus large, cette initiative de la Semaine européenne de l'immunisation offre à l'Europe entière l'occasion de reconnaître l'importance et la nécessité d'endiguer les maladies qu'un vaccin peut prévenir. Je me réjouis de pouvoir célébrer en 2011 une semaine européenne de l'immunisation couronnée de succès et de collaborer avec l'OMS et ses partenaires pour soutenir cette initiative durant l'année qui vient. Je vous remercie. I thank you.
Un grand merci à vous aussi. Merci.